This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
So I'm Navi. I'm one of the PGY4 chief residents here at NYU. I'm just loading up my screen. So NYU PM&R, it's a pretty historic program. It's based off of Dr. Rusk, who came to NYU back in 1948. He established the first university-affiliated department in rehab medicine. We have a lot of firsts and a lot of history associated with our program. We have aphasia protocols, vocational reintegration, pediatric rehab, and psychology, rehabilitation psychology. The department was renamed in his honor in 1984, so now we are known as Rusk Rehab, and our mission statement is to provide patients with the necessary physical, social, vocational, and recreational to reach the highest possible level of independence and quality of life. We really try to stay true to this motto. We've been #1 ranked by, I believe, US News for a very, very long time. And then nationwide, we used to be #9. This year, we're #4. So we're really on an upward trajectory in terms of the top rehabilitation hospitals for patients in the country. Okay. Oh. So this is our program leadership. Our department chair is Dr. Flanagan. He used to be the AAPM&R National Board. I believe he was the president last year as well. We have Dr. Morose. He's our program director. Dr. Lopez, he's our APD, and Dr. David Kumar, who is also our APD. And then we're the chiefs here on the side. So I'm Navi. We have Max, Matthew, Lucy, and Keyshawn. We all work together in different facets of leadership and involved in the program to make it as running as efficiently as it can. We have 36 residents with 12 advanced positions per year. We do require that the intern year be done elsewhere. We're not combined. And we have 2 fellows in the department. We have a TBI unit and a sports medicine fellowship as well. These are just some of us residents do. So in intern years, PGY's 2-4. PGY 2-year is definitely very similar to other programs in that it is more inpatient focused. We are a little bit more front loaded when it comes to floors. And then your PGY 3-year is a combination of floors versus outpatient, a lot more time to see what the other outpatient aspects of rehab medicine look like. And then PGY 4A, you're going to be doing a lot of consults, a lot of outpatient, and having stronger development of leadership skills. That's where we try to, really focus on what your career plan is, whether you want to do fellowship, if you already applied for fellowship, because some are earlier than others, but what you really want to do and what you hope that your life looks like outside of residency. We have a very strong mentorship program. So all incoming PGY2s are essentially assigned a mentorship family. So it's going to be with a PGY3, a 4, and 1 to 2 faculty members with some sort of interest that they've shared. So they might say that, oh, I'm interested later on in doing general rehab. We might pair you with somebody that did not decide to do a fellowship, and or you might say you're more interested in outpatient or a certain specific fellowship, and we try to match you with our very large, attending base with somebody who has, your career goals. Our alumni do very well for themselves. They have kind of gone everywhere around the country in the last. This is a list from the last 5 years. It actually doesn't even include all of them. We just have so many different places that the fellows, that our residents end up going. And we do have currently more residents applying for fellowship than not for fellowship, deciding to go, directly into practice after training. Within the last few years, with pain, we've had residents match Emory, Mount Sinai, in California, UCSD, UCSF, Virginia. So all over the city, all over the country, really. Very similarly in sports, last year's chief, Dr. Callahan, matched at Northwestern. We've had Mount Sinai, NYU, a lot of different locations. Pediatric rehabs. Last year we had a resident go to Spalding. We've had spinal cord injury matches in the past that have gone to Spalding. And then we've also had TBI, people match in TBI at UPMC, at NYU, at Kessler. So really just all over the place. And then in academic jobs, they might go into private practice. Some of them have gone for academic jobs at Johns Hopkins and Spalding. And then we also, of course, have the NAS match. We've had residents match at HSS, UPenn, Johns Hopkins, Cleveland, OSS, Michigan, and Rochester. And then non-ECGME PM&R fellowships like spine, we've had them match all over the country as well. We have 3 primary locations that you're going to be working in, especially in your PGY2 year, which are going to be, the 3 major health systems are NYU Health. So that's, over 1,000 beds. That's Tisch Hospital, Kimmel, LOH, which is Langone Orthopedic Hospital, where Rusk Rehab is primarily located. That's those centers over there. Then we also have NYU Health and New York Health and Hospitals, also known as Bellevue. That's the oldest public hospital in the USA. It was opened in 1736. It is the designated trauma center in Lower Manhattan, and that is where we have our locked TBI units. That's where we really do get a majority of our trauma training, our traumatic brain injury training. And then lastly, we also work with the Manhattan and the Brooklyn VA. It's part of the New York Harbor Health System. And then as residents, we do not do inpatient rehab here. We actually only do outpatient, which is a huge plus if you're not necessarily interested, or you're more interested in outpatient, you got a lot more exposure here. Our inpatient site, so we have Tisch. At Tisch, we have HCC9 is what it's called. That is where primarily a lot of our transplant patients go. We have a lot of different types of transplant patients or higher risk patients that are located at Tisch. That's a 22-bed hospital. Then at Bellevue, we have 30 beds. It's a locked unit where we also have TBI patients. And then at Langone Orthopedic Hospital, we have 48 beds. We also have a lot of outpatient clinics. We have the Ambulatory Care Center, the ACC, LOC, which is the Orthopedic Center. Bellevue, we have 2 outpatient clinics. We have 4 outpatient clinics at the Manhattan VA. We have an outpatient clinic at the Manhattan VA. We have, of course, LOH. And then we also in Brooklyn have Brooklyn VA, which is a little bit further. It's in we have NYU Brooklyn at Sunset Park. Okay. So some of the outpatient clinics that you guys would be working in include sports medicine, pain medicine, ENG. We have cancer rehab, TI, stroke, SCI peds, cardiopulmonary rehab, brace, muscular dystrophy, diabetic foot and ankle, and dance clinic. So we have really just a huge variety of outpatient clinics that we work at during our outpatient time. We all use Epic in all of the NYU and Bellevue systems, and the VA nationally uses CPRS with their own system. It's quite easy to learn. It might be to really learn it. It's very, very simple. So overall, there isn't like a lot of relearning for each new, like working at Bellevue versus working at an NYU affiliated hospital. It's not, difficult to carry over the documentation side of things. Our residency schedule looks a little bit more like this. So in PGY2 year, like we said, there is more inpatient time. Primarily, you have about 8 months of inpatient time, and half of it is at LOH, which is, of course, the NYU hospital, and then the other half is going to be in Bellevue itself. Bellevue is split into 1 month where you have dedicated inpatient and clinic and consults, which is about half inpatient, half outpatient. You can be doing either consults or clinics, or you might be covering your co-residents at the inpatient site. So that's why it's kind of half and half there. In between those things, you have 4 months of outpatient. So that's going to be the Manhattan VA, the ambulatory care center, sports, and the introduction to EMG. Our EMG, curriculum is dedicated with the neurology department. So we work in their outpatient site. It's quite lovely. We have a lot of EMGs that are happening throughout the day, and there are some EMG fellows there. There are about 2 fellows there, but they'll help teach you, as well as the attendings will help teach you. It's a pretty collegiate environment. Sports medicine is done at Lincoln Orthopedic Center, and that's typically, a lot of sports medicine, some spine as well. ACC is going to be where you have a lot of different types of clinics like cancer rehab, muscular dystrophy, brace, things of that nature. And then MVA outpatient, you can have a large variety of patients there as well. PGY3, you start transitioning more into more outpatient than you do inpatient. You have 3 months of being the floor senior now at LOH, and 1 month of our HCC9 rotation. So that's over at Tisch. Otherwise, you're really doing, clinic consults, Tisch consults, and a lot more outpatient time. And then finally, in your PGY4 year, you have mostly outpatient time and elective time, and only 1 real inpatient month, which is as a Bellevue floor senior. Otherwise, you're going to be running consults. You'll have 2 months of elective and 1 month of procedure. So the 2 months of elective are really what you make of it. Some people have, we also have a dedicated track system. If you would like to apply to fellowship early, we have 3 tracks that you can get the elective month, one of them, in your PGY3 year towards the end in April, May, or June. And you would have that month removed in your PGY4 year with an extra month of Manhattan VA. So that's kind of how we encourage people, if they want to apply to an earlier fellowship, or might want to do audition rotations for their fellowships, they can do that. Otherwise, your elective rotations in your PGY4 year are really what you make of it. If you would like to do audition rotations, if you would like to do interviews during this time, dedicated research during this time, it's really up to you. Procedures very similarly have more limited days of scheduled time with attendings, with the majority of the time being, if you yourself know which numbers that you might be short on for your procedures, as ACGME does mandate certain procedure numbers, you can just go ahead and try to work with attendings during that time. The weekly average hours on the side that you see, those are also, I would say they're pretty accurate for your PGY2 and 3 years. Sometimes in your PGY2 year, you might work more in your LOH months, but sometimes you work much less too, so it does average out. And your PGY4 year, I would personally find that to be a bit of an overestimate. That might be during one of the busier months, floor year, but otherwise you're really around 40 hours, I would say. So call sites, so call is always a really important question. Everybody always asks us. So you have 3 areas where you can take call. The first place is going to be HCC9. So this used to be a location where we used to have 24/7 coverage that was resident run. However, about 2 years ago, we actually stopped that. Now we only do weekend day coverage. During the week, it's, the primary HCC9 resident, the nurse practitioners on the team. And then on the weekend, it will be a resident covering from 7 a.m. to 7 p.m. And then from 7 p.m. to 7 a.m., a nocturnist is actually going to cover us from the hospitalist, from the Tisch Hospital, which is really wonderful opportunity that we have. It's really cut down on our calls. Then we also have Bellevue, where we do take overnight call. And that's going to be, we do have a call room there on 6 West. And then at LOH, we also do take overnight call there. And our call is in the 4th floor. Our call frequency ladder, it's definitely more front loaded. As you progress throughout your residency, you're going to have fewer and fewer calls. PGY2 year, you can have anywhere from 2 to 4 calls a month, about 40 calls a year. And of that, though, it's a pretty even split. So 2 calls of the month are going to be during the weekdays, and then 2 calls of the month will be during the weekends. And you will be responsible for Saturday calls at this time. So maybe one Saturday a month, one Sunday a month is on average. If you are going to have 2 weekend calls, that's how it would look at like. You get post call days, of course. And then for your Sunday call and your weekday calls, Saturday call, technically your post call day is Sunday. So that's why we try to limit the amount of Saturday calls that we give. When you're a PGY3, then you only do about 3 per month on inpatient site. So that's about 23 calls a year. It is a significant drop, even though the number might not seem like it. Okay. And you have like one which will be Sundays, or we have one a month that might be a Sunday and there's no Saturdays, and you have 2 months that don't have call. So at the VA, we don't take call because we don't have inpatient sites there anymore, but it's only outpatient. PGY 4-year, you might have 2 calls a month for 4 months. So we have about 8 calls a year, and then we have 2 Sunday calls the entire year. And we have about 5 months of no call because we have 3 months of VA and 1 month of elective. So it is much easier. They're only Monday through Thursday at the PGY 4-year. PGY 3, you might have 1 Sunday, but you have no more Saturdays. So it's really only the PGY 2-year that you're going to be working Saturdays. Our residency pay and benefits. So we get 20 days of vacation, 5-day blocks. We also get 10 sick days on top of it that you can use, mental health days, or of course, just sick days. You just let the ACR or the chief residents know. Education stipends. So because we have some residents at Bellevue and NYU, we do have a difference in salaries, just to let you know, this is pretty important. There is a slightly lower salary for Bellevue residents at this time than NYU residents, but they are working on increasing it very soon. And then on top of it, we have conference funds. So CIR, which is Bellevue, gets a larger conference fund to get larger educational stipends, but their base salaries are lower. They also can cover one another, Bellevue residents, for extra pay. I believe it's about like a couple $100 that they get to do that. And then we also have something called an E program where residents can help each other doing weekend admissions, and you get $100 in admission that you do, and about $50 on Fridays for each admission that you do. I think 75, sorry. So our current salaries for NYU residents is listed right here. We are now getting a 3,800 meal allowance. So with everything in your PGY 2-year, you're going to start off with 85,800. Technologies, we get iPads, we get books, apps, we get ultrasounds at each site, sonosim, ultrasound courses, injection models, and books that are provided through our virtual library to think of. Our curriculum, we have didactic times on Tuesdays from 12 to 3. We try to avoid having PGY2s do Monday call to make sure that they're able to come. We have ultrasound workshops as well every 6 weeks. That's pretty interactive. Anatomy labs every 6 weeks, very interactive. We have snacks and coffee provided at almost all of our didactics. We does run journal club every Fridays. Our didactics, though, are attendings. Like, we're not the ones that are responsible for the curriculum. Like, the attendings come in and they lecture us from across departments. Alumni across the nation come and lecture us, and it's very protected time. We have a nurse practitioner take the pager at NYU, and at Bellevue, the attendings are responsible for their patients during this time. You are not responsible for anything patient related during this time.
Warning.
Yep. And then we have injection didactics and ultrasound workshops. We get a PM&R recap subscription, a PM&R QBank subscription, ultrasound guidance, Ipsis lumbar curriculum, and Asia InStep subscriptions as well. And our culture overall is very supportive. We strive on improving. We have quarterly town halls with chief residents and program directors to discuss any ongoing issues. We're very resident driven with a good work-life balance and a supportive culture for new parents and breastfeeding. We really just strive on trying to improve the amount of wellness activities that we have for our residents, and our PDs are very focused on trying to improve the culture and making sure that, we really prioritize wellness, especially of our PGY2s. Wellness events that we do have, we have dedicated wellness chiefs in the PGY 2-year to help discuss burnout and wellness events specific to the PGY 2s. We've increased the amount of happy hours we have. This is not like a residency thing. It's just what we do together weekly, bi-weekly. We also have residency funded welcome events, holiday parties, wellness picnics. We have a women in medicine group. They did a paint and sip for us last year that was covered. And before that, we had a manicure event, a manicure pedicure event. We've also had a PM&R group and alumni events that are sponsored, and we get holiday catered didactics during Christmas and Thanksgiving. And we have holiday parties and potlucks with our co-residents at their apartments. Most of our house staff currently live in Manhattan, Brooklyn, Queens, and New Jersey. A lot of us really do live in Manhattan. We have endless entertainment. It's New York City. There's so many parks. There's so many things to do. We go to restaurants. Restaurant week, we try to like find a restaurant for some of us to go to, and we all go together. We're trying to do Broadway this Broadway week. It's been really fun. We try to do as much as we can together, and everybody enjoys, being in New York City. These are all of us, in all of our events. These are the current residents. And this is me. I'm Navi. I'm responsible for residency recruitment. You can email me at any time, and our program coordinators, Sophia and Claire, are also available via email. I would consider them probably one of the strongest things we have in our program. They are very helpful. They are not at all obstructive to helping us get our things done. They're just honestly all around really wonderful people. So that is it for me. Sorry, that's for 2024, 2025. You can just like learn about us. These are some virtual tours that we have. And do you guys have any questions with the time we have left?